So let's start with the type 1 diabetes. So what happened in the type 1 diabetes? Suppose this is your pancreas. Suppose this is your, let it be, it's a pancreas. Okay, so this is the tail of the pancreas. And here these are the alpha cell. And they are the surrounded by this, the beta cell. Okay, the beta cells. So what happened in type 1 diabetes? There is a destruction of the, there is an destruction of beta cell. Okay, due to what? Due to some here antibody is produced against the beta cell. So there is an enzyme. The enzyme name is your glutamic acid decarboxylase. Okay, so GAD. The enzyme name is your glutamate acid decarboxylase. Just write it here. Glutamic acid decarboxylase. And this enzyme, it is present in the pancreas. In type 1 diabetes, the immune system mistakenly produces autoantibodies against this enzyme, that is GAD. So if you see in the blood report, so in the type 1 diabetes, you have to go with the blood report of, that is, there is a presence of GAD antibodies, okay? So here, what is it is a basically a marker of type 1 diabetes, that is GAD 65 antibody tested. Here, the presence of the GAD is markedly decreases. It is one of the marker of, that is, this is a type 1 diabetes. Okay. So we know that in sugar level, there is in fasting in the blood sugar, that is, fasting level, you have to go with the PP level and HbA1c. So these are the things. But to know whether it is a type 1 diabetes और इट इज अ टाइप 2 डायबिटीज, और ये क्या ये टाइप 1 डायबिटीज है, क्या ये टाइप 2 डायबिटीज है, इसको जानने के लिए हमें GAD 65 एंटीबॉडी टेस्ट का एग्जाम करना पड़ेगा. ओके, सो दिस इज बेसिकली अ मार्कर ऑफ द टाइप 1 डायबिटीज. एंड रिमेंबर द ब्लड शुड बी द वेनस ब्लड, and here no fasting is required. Okay, दूसरा जो टेस्ट होता है, देयर इज एन सेकेंड टेस्ट विच इज नोन एज योर सी पेप्टाइड. ओके, सो दिस इज कॉल्ड सी पेप्टाइड. And here also in the type 1 diabetes, the C peptide is also decreases. So these are two investigation you should do for the type 1 diabetes to know whether it is a type 1 diabetes or it is a type 2 diabetes. So these are some of the clinical features. If you see in the type 1 diabetes, there is an absolute insulin deficiencies. The onset seen in the childhood, insulin absent or very low, the body weight is lean or the normal. Family history is less common. In type 2 diabetes, family history is very much common. Type 1, the onset is sudden. Ketoacidosis is very common. And autoantibodies which are present is anti-GAD antibodies. And along with this, there is a decrease in the C peptide level. Okay, so the decrease in the C peptide level or C peptide level is absent. Okay, so in the MCQ, they can ask you what is the antibodies or what is the marker of the type 1 diabetes. Okay, so these are the MCQ questions they can ask you in your examination. So let's go some example of the MCQ. Okay. So the first question is, which of the following HLA type is most commonly associated with the type 1 diabetes? Okay. You can type your answer in the chat box. Is it HLA-DR2, HLA-DR3 and DR4, HLA-B27 and HLA-DQ1? Just type your answer. Yes. So let me disclose this. Here the answer will be your HLA, DR3 and DR4. Okay, so here the answer will be HLA, DR3 and DR4. So go with the explanation. So this one, HLA-D3 is strongly associated. HLA-D4 is also strongly associated. And HLA-D3, D4, they are higher risk for the type 1 diabetes. And the HLA-DR2 is protective. Should note this one. It's a very important point. Okay, that is, it is a protective. HLA-B27 and associated with ankylosing spondylitis, not T1DM. HLA-DQ2 and DQ8 is also implicated in T1 type 1 diabetes mellitus. Remember, children or individual with HLA-DR3 and DR4 are higher genetic risk for developing the type 1 diabetes, especially when combined with some environmental triggers. Now, next question, which of the following is not a feature of type 1 diabetes? Onset before 30 years, yes. Most commonly seen in the young age. Presence of antibodies, yes, we know there is a presence of autoantibodies, which restriction, like here the presence of like autoantibodies are there. Obesity, no, the person is very much lean. Okay, he is not obese. And obviously insulin dependence. So which of the following is not a feature of type 1 diabetes? The answer will be answer C is obesity. Now just tell me the answer. Which of the following antibodies is more specific for the type 1 diabetes? Okay. Anti-insulin antibody, GAT antibody, islet cell antibody, zinc transporter antibody. So just wanted to tell you that GAD antibody is most commonly, okay, it is most common test. But if the question asks what is the most specific, the answer will be your zinc transporter antibody. Okay, so this is the explanation. Auto antibodies associated with the T1DM. Okay, in order of the appearance and the frequency. So remember this chart, that is anti-GAD, islet cell antibodies, and insulin antibodies. Okay, so let's move to the next question. Okay, so let's move to the another question. So type 1 diabetes, that is our honeymoon phase in type 1 diabetes, refers to the option A, early stage with severe insulin resistance. Option B, period of normoglycemia after insulin initiation. Period of ketone body surge, time before the diagnosis. Okay, so here the answer will be a period of normoglycemia after the insulin initiation. Okay, so if you start insulin, the blood sugar level improves, some beta cell which get destructed, it's also get recovered temporarily. Okay, and afterwards insulin needs to go down, but only for a short time, and autoimmune destruction still continues. Okay, so basically remember this for the student, honeymoon phase is sweet and short phase. Okay, so this is all about your regarding the type 1 diabetes. So in the next class, we will do the diabetic ketoacidosis. So diabetic ketoacidosis is basically one of the feature of the type 1 diabetes. Okay, so my next topic will be about the diabetic ketoacidosis. So what happened in the diabetic ketoacidosis and why it's occurred in type 1 diabetes.